Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of October 20th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. Today, we'll be cutting through the noise surrounding budget impasses, reductions in force, and government shutdown, to illustrate exactly how political instability is directly endangering public health and patient safety. So I want to start with a necessary update on the stability of our public health infrastructure, or lack thereof. The federal government shutdown has now dragged into its third week, becoming one of the longest in history, and it is actively being weaponized to cripple our federal health agencies. This is no longer just a pause in data, as we reported a couple of weeks ago. It is now institutional chaos. We saw it last week with the mass politically driven reductions in force across health and human services. And even though the administration did seemingly scramble to reinstate about 700 staff, including the entire team, for the morbidity and mortality weekly report, which we certainly rely on, and also key measles response personnel were apparently reinstated. But the initial firing and subsequent rehiring of these critical scientists has created an environment of instability and whiplash. Key functions like the Institutional Review Board and Human Resources are still decimated. Fortunately, the CDC's measles case counter is deemed essential right now, which I agree with, since we are in the midst of a massive and continually evolving outbreak. So that is still being updated, but no updates on respiratory viruses. And as we enter the heart of respiratory season, we have no updates in data, no reliable MMWR reports, no routine respiratory disease updates. And so public health officials are having to rely either on local data or piecemeal data, or worse, just operating blind. And the CDC's ability to communicate, interpret, prepare for other threats has been severely damaged. So this appears to be a deliberate erosion of expertise, and this is the context of some of the political decisions we're going to discuss today, including the deliberate spread of dangerous and politically driven misinformation and disinformation. So this brings us directly to a key recent news item that perfectly illustrates the danger of political interference in public health, and that is the recent actions taken regarding acetaminophen, or Tylenol, use in pregnancy. So by way of a little bit of background, acetaminophen, which is also known in some places as paracetamol and sold under brand names like Tylenol, among others, which I'll talk about in a moment. This is one of the most widely used medications for pain and fever relief in pregnancy. It is currently the only over-the-counter fever medication approved for pregnant women in the United States. On September 22nd, the FDA issued an alert to physicians nationwide, suggesting that acetaminophen use during pregnancy may be associated with an increased risk of neurological conditions, including autism and attention deficit hyperactivity disorder in children. The FDA announced plans to update the labels of acetaminophen containing products, but even they had to admit and emphasize that a causal relationship has not been established, noting that evidence remains inconclusive. But still, without evidence, the alert recommended that clinicians minimize use for routine low-grade fevers. And that same day, President Trump publicly argued that publicly urged pregnant women to not take Tylenol and to just tough it out. A highly problematic statement that I'll talk more about in a moment. Now, as a physician, I want to be completely clear: the action and these statements run counter to the evidence. Over 2 decades of studies on acetaminophen use in pregnancy have not identified a causal link to autism, ADHD, or other neurologic disorders. The highest quality studies, including this JAMA paper from 2024, consistently show no significant association between acetaminophen use and such risks. You may have heard this referred to as the Sweden study. It's incredibly comprehensive and well done. Researchers tracked 2.5 million children born in Sweden from 1995 to 2019 and used sibling controls. And this was to help account for both genetic and environmental factors. And the result was there was no increased risk of autism, ADHD, or intellectual disability among children whose mothers use acetaminophen during pregnancy. So the authors conclude that there is no evidence of causation between acetaminophen use and neurodevelopmental disorders. And on top of that, over 2 decades of studies on acetaminophen use in pregnancy have not identified any causal link to autism, ADHD, or any other neurologic disorders. Any studies that we've seen to date that even suggest a link rely on self-reported data or fail to control for confounding factors or important variables like fever, infection, or inflammation, which those themselves could increase the risk of neurological issues. So you absolutely cannot base public health guidance on statistically weak or methodologically flawed studies over very large, clear, and well-done studies like the 2024 JAMA paper. But unfortunately, that is exactly what this administration is attempting to do. Following these unfounded guidelines would place pregnant patients in an impossible situation. Untreated fever and severe pain, especially in early pregnancy, are associated with known potentially devastating risks to the fetus and the mother. So while it is appropriate to be aware of and explore unconfirmed theoretical risks, we must be absolutely clear that avoiding acetaminophen altogether based on these fears is dangerous and medically reckless. So first off, untreated fever during pregnancy can lead to serious health problems for the baby. So as a fetus develops, every stage of development needs to happen at the right time for the organs and the tissues to form correctly. And a high fever can interrupt that process in part by activating certain proteins called heat shock proteins. And these can disrupt the proper development of the baby's brain and or spine. You may hear of these collectively referred to as neural tube defects, so affecting the development of the baby's brain and or spine, or the heart, which we call congenital heart defects. And so these are structural issues that occur in the development of the fetus if a high fever occurs. It can also cause an opening in the upper lip or the roof of the mouth, known as an oral cleft or cleft palate or cleft lip. So the specific malformations depend on the stage of the pregnancy, and the earliest part, the first trimester of the pregnancy, is the most vulnerable time. Secondly, unmanaged pain and inflammation may also pose risks. They can increase stress hormone levels, which can affect the brain development of a fetus. And again, depending on when in the pregnancy, this could also lead to preterm birth or the baby being born too early. So fortunately, the consensus among basically every other medical body in the world is that established risks of untreated fever and pain in pregnancy far outweigh any theoretical, inconclusive, or suspected by politicians risk of Tylenol, especially when it is properly used. World Health Organization has emphasized that no consistent association between prenatal acetaminophen exposure and autism has been demonstrated in the extensive research conducted over the past decade at least. Also, medical societies that look out for pregnant people and babies, like the American College of Obstetrics and Gynecologists, the Society for Maternal Fetal Medicine, and the American Academy of Pediatrics, all concur. Untreated pain and or fever in pregnancy pose real dangers, while there has been no proof that Tylenol causes any harm at all. So of course, it is fair to ask, why does it seem like we are seeing more autism? And I'm not going to go over autism comprehensively today, but as I have said here repeatedly, we need to not only be able to ask difficult questions, we need to be prepared what we need to do to answer those questions. So we can't just manufacture ideas and then work backwards from there. So thus far, the evidence for apparent increases in autism rates are multifactorial. And if we want answers, we're going to have to be rigorous in seeking them. So first off, it likely reflects much better recognition and diagnostic access, not actual increases in autism. So there is no question that awareness of autism has increased dramatically. Our ability to assess children and make the diagnosis and make it earlier has also dramatically improved. Also, many families seek better autism services, so they may relocate to areas with better autism services, and this can further skew the statistics. And let's always remember that association is not causation. So many factors, including maternal illness and inflammation, can explain some of the associations that were observed in some of those weaker studies that I mentioned that do not account for these important issues. So, for example, if you're pregnant and you get sick, you have a fever, and then you take Tylenol, you have to actually account for all of these things. Was it being sick? Was it the sickness? Was it the fever? Was it the Tylenol? Or was it none of those things? Or was it something else altogether? So all of this would take actual proper study design and rigorous analysis to parse out. And this simply has not been done. So it's not enough to just ask or insinuate. We have to actually do a proper analysis to draw conclusions and then to shape guidelines, or at least that is how it's supposed to be. Something we really should be focusing on is ensuring that those who are diagnosed with autism have access to the resources they need to live their fullest life, and that parents and caregivers have the support and information that they need as well. So this is where resources must be directed instead of being threatened by the shutdown and reductions in force that are crippling our ability to conduct and fund research and to support actual resources to the people that need them. We know that autism is a complex spectrum and there is no one size fits all. And there will likely not ever be one diagnostic study or one treatment for all. So we must be dedicating efforts to providing resources and tools to meet diverse needs. So if we know all of this, if we know that the risk of untreated fever and unmanaged severe pain are dangerous for pregnant people, then we can see why the statement that pregnant people should just so-called tough it out is dangerously false. And I think it's important that we call this what it is. This is a textbook example of starting with a preconceived ideological conclusion and then selectively reverse engineering policy to fit that conclusion. So in this case, they're looking for a simple answer to a complex, multifaceted diagnosis like autism. And this has led them to willfully ignore a fundamental medical fact, the known serious harms of untreated fever and pain during pregnancy. So the true public health concern here is not the risk of autism, but the risk of undermining public trust and medical expertise and encouraging patients to leave fever and pain untreated. A deliberate action that politicizes a drug safety and sets a dangerous precedent. So I will not pretend to know why Tylenol specifically got caught in these political crosshairs. But what is undeniable is that this administration has chosen to ignore established medical facts and implicate an important medication based on unwarranted suspicion. The pregnant patients and our next generation will ultimately suffer the harm of this recklessness. And amidst this manufactured controversy, we risk overlooking an actual, genuine, persistent, and deadly crisis that is directly relevant to our focus this month, and that is acetaminophen overdose. So Tylenol is one of the most widely available medications in the American home, and that widespread availability makes it a leading agent in both accidental and intentional overdose. Taking too much acetaminophen can lead to severe liver damage and can be fatal. In fact, acetaminophen overdose is the leading cause of acute liver failure in the US and the second leading cause of liver transplantation worldwide. In the United States, every year, acetaminophen overdoses or toxicity cause approximately 50,000 emergency department visits, 2,600 hospitalizations, and 500 deaths. And it's important to note that about half of these cases are unintentional. often due to mixing multiple acetaminophen-containing products or misunderstanding dosage instructions. Acetaminophen is actually the most common drug ingredient in the United States, found in over 600 different prescription and over-the-counter medications. Everything from cold and flu remedies purchased over the counter to Vicodin and Percocet, which contain acetaminophen along with an opioid. So I am definitely not picking on any particular brand. Just know that it is very common, in combination products, and this has to be looked at. So the maximum recommended adult dose of acetaminophen is 4,000 milligrams per day, but this is from all sources combined, and this is for those with a healthy liver. So if you don't have a healthy liver, then the maximum recommended adult dose may be lower or may be better to abstain altogether. So this will be up to you and your primary care provider to figure out. But for adults with a healthy liver, maximum dose 4,000 milligrams per day from all sources combined. So to prevent accidental overdose, you got to check the milligrams per dose in all the medications that you take. And avoid taking more than one over-the-counter medicine containing acetaminophen. Don't combine prescription and over-the-counter acetaminophen unless you've been instructed to do so by your healthcare provider. Ask your provider whether anything they prescribe to you has acetaminophen in it, and share a list of any other medications and supplements that you may be taking. Also, note that acetaminophen might appear under abbreviations. The most common one is APAP, and so it'll be like capital APAP. So for example, Vicodin will say hydrocodone/APAP on the label. So you have to count the APAP milligrams when you are adding up your acetaminophen sources. So just briefly, I'd like to touch on acetaminophen overdose and liver toxicity. So symptoms of overdose could be nausea and vomiting, abdominal pain, confusion, and yellowing of the skin or eyes, which is jaundice. Some people might not have any symptoms at first, and signs of toxicity can take several days to appear, and they might initially look like a flu or cold. Severe cases can result in acute liver failure. This could require liver transplantation, and it could be fatal. So recognizing it and treating it early within 8 hours of overdose is critical. This dramatically reduces the risk of serious liver damage or death. So getting to a medical facility immediately as soon as possible. Now, a critical component of managing acetaminophen is safe storage and disposal to prevent overdose. So we've already just talked about accidental overdose from combination products, but we do also have to address the risk of intentional overdose. Acetaminophen is one of the most common agents involved in adolescent self-poisoning and suicide attempts. Its easy accessibility in many homes makes it a lethal means in a moment of crisis. So our advice has to go beyond simply protecting little ones from getting into the medication. We need a comprehensive message for all families. Store all medications, prescription and over-the-counter, securely locked out of sight, not just to prevent accidental ingestion by toddlers, but also to reduce access for depressed or impulsive adolescents in particular who might be struggling with thoughts of suicide. As public health advocates, addressing this risk is part of our larger duty to support our youth in particular. Safe storage of common household medications is a proven clinical means of suicide prevention, of course, in conjunction with longer-term behavioral health support. So this quiet, deadly crisis of non-opioid drug overdose is a core part of Substance Use Awareness Month, highlighting that misuse, accidents, confusion can turn even the most common pain relievers into a lethal threat. And now I'm pleased to hand it over to two of our amazing clinical program team members, Vanessa and Camilla, to discuss a fuller spectrum of substance use and overdose awareness.
Thank you, Dr. Naha, for having us on the public health briefing this week in honor of National Substance Use Prevention Month. We are the clinical programs team for the Substance Use Program, and my name is Camilla, and this is my colleague, Vanessa.
Thanks, Camilla. So today we will be defining substance use and understanding it as a chronic condition. Then we'll review substance use statistics nationally and within Alameda County. And then we'll also define first-person language and how we could use it to destigmatize substance use within our communities. And then finally, we'll review the resources Roots Community Health provides.
So, as we said earlier, October is Substance Use Prevention Month, and Substance Use Prevention Month is used to highlight the vital role of substance abuse prevention in both individual and community health, to remember those who lost their lives to substance abuse, and to acknowledge those in recovery, as well as their children, parents, family, and friends supporting them. So, what is substance use? Substance use is commonly known as a drug addiction, and it's a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal substances, such as alcohol, marijuana, and nicotine.
Now, substance use disorders were once viewed as a character flaw or moral failing, but are now recognized as long-term conditions that can seriously affect a person's health, relationships, and ability to control their use of drugs or alcohol. Now, substance use disorders have many features in common with diabetes, asthma, hypertension, because all of these conditions are chronic and treatable. Now, it is influenced by genetics, individual life experiences, behavioral, social, and environmental factors. And some of these factors, like I said, can affect the likelihood and speed of developing an addiction. So, for example, family history of addiction slash genetics. So, developing a drug addiction is more common in some families and likely involves an increased risk. So let's say if a person has a blood relative, such as a parent or a sibling with alcohol or drug addiction, a person is at greater risk of developing the same addiction. Now, when we bring mental health conditions into this realm, if a person has a mental health condition such as depression, attention deficit slash hyperactivity disorder, otherwise known as ADHD, or post-traumatic stress disorder, otherwise known as PTSD, they're more likely to misuse substances because it can become a way of coping with painful feelings such as anxiety, depression, and loneliness.
On top of that, misusing drugs or alcohol at an early age can cause changes in the developing brain and increases the likelihood of progressing to a drug addiction. However, the risk of substance misuse varies by the type of drug. Some drugs, such as opioid painkillers, have a higher risk and cause addiction more quickly than others. If we take a look at this graph over here, we can see that the graph displays the probability of substance misuse based on how long the opioid has been prescribed to an individual. If we take a look at this trend over here, the longer one is prescribed an opioid, the higher the chances are of becoming dependent on the drug.
Thanks, Camilla, for shedding light on that important statistics. Now we'll take a look at the national statistics on substance use rates. So, on a national level, among Americans aged 12 years and older, 47.7 million individuals developed a substance use disorder in the past year as of 2023. Now, when we focus in a bit more on Oakland slash Alameda County, as of 2022, an estimated 112,000 individuals above the age of 12 years or older had a substance use disorder.
The impact on substance use within our communities is highlighted even further when we take a look at emergency visits. So if you take a look at this graph over here, these were the hospitalizations and emergency visits from 2019 and 2020. You can see here that the African American and Black population had the highest rates of opioid-related visits within that year.
So, people who may be living with an addiction or substance use disorder may encounter negative stereotypes and false assumptions that promote shame and discrimination. So, it is important as a community to use person first language because it places the individual before their condition. So, for example, instead of using addict or junkie, we could say person with a substance use condition. Instead of using addictive personality, we could use vulnerable to addiction. And then finally, instead of saying alcoholic, we could use person with alcohol use disorder. Now, an individual who misuses substances is still a person worthy of respect. They're just learning how to build healthy coping mechanisms.
to highlight our role in the community and how we can help with people who may be struggling with substance use, I think it's great if we switched over and started talking a bit about naloxone. So naloxone is also commonly known as Narcan, and it's a life-saving medication that can reverse an overdose from opioids, which includes fentanyl, heroin, and prescription opioid medications by blocking the effect of these drugs. It can restore normal breathing within 2 to 3 minutes in a person whose breathing has slowed or even stopped due to an opioid overdose. There are two forms of naloxone. There's the pre-filled nasal spray and an injectable. For the purpose of this presentation, we'll be focusing on the pre-filled nasal spray because this is the most accessible version of naloxone available to our community. Typically, injectable naloxone is only used in a hospital setting. So carrying naloxone is no different than carrying an EpiPen for people who have severe allergies. It simply provides an extra layer of protection for those at a higher risk for overdose. Anyone can carry naloxone, give it to someone experiencing an overdose, and potentially save a life and prevent a fatal overdose. Here we can take a look at our online mapping, which shows all of the local Narcan distribution areas within Alameda County. It's important to take note of these hotspots because these are places where we can find Narcan and you can potentially save a life. If you're interested in learning how to administer the nasal spray Narcan, the CDC has a quick 30-minute video or 30-second video, I'm sorry, that we'll link below. And so it's also important to note that overcoming an STD is not as simple as resisting the temptation to take drugs. Recovery may involve medication to help with cravings and withdrawal, as well as different forms of therapy. Here at Roots, we utilize trauma-informed and harm reduction approaches to treating patients with substance use disorders because we recognize that adverse experiences such as gun violence, domestic violence, and adverse childhood experiences contribute to the onset of substance use conditions, and that it should be systematically addressed in prevention, treatment, and recovery. So some of the resources we offer are these SUD Safari Group therapy classes. We have them on Mondays from 1 to 2:30 p.m. And we also have them on Wednesdays from 10 a.m. to 11:30 a.m. On top of that, we have the behavioral health therapy services. And so we can have members come in to any of our sites for behavioral health therapy, and they could sign up for one-on-one therapy or even join our group therapy first and ease their way into one-on-one therapy. On top of that, we also have our street medical team, which is commonly known as STOMP. And so STOMP goes into our neighboring homeless encampments and provide medically assisted treatment services as well as regular medical services. And then last but not least, we have Welcome Wednesday. So every Wednesday, we open up our clinics to the community and we offer medical services, behavioral health services, navigation services, and we also have a food distribution table where we offer free groceries and a hot meal. I hope to see some of you at our next Safari group or even at Welcome Wednesday. I'd like to say thank you to Dr. Noha for her honor in National Substance Use Prevention Month.
Thank you, Vanessa and Camilla, for that comprehensive overview, which reinforces the fact that in the face of systemic instability, our personal and community resilience is our best defense. We have got to look out for ourselves and one another. We cannot afford to wait for government health agencies to stabilize before we act. So let's turn to 3 best practices to keep ourselves, our loved ones, and our communities safe, anchored in the lessons we've learned today about the intersection of public health and policy. First, be the filter. Seek information from trusted sources. In a time of political noise, ignore those headlines and look to where you know you can trust. You know you can always come here to the People's Health Briefing. Also, look to medical bodies that put scientific consensus above politics, like the American College of Obstetrics and Gynecology, World Health Organization, American Academy of Pediatrics, American Academy of Family Practice, just to name a few. Second, prioritize medication safety and secure storage. As we've discussed, acetaminophen overdose is a leading cause of liver failure and death, both accidental and intentional. Please ensure that all medications, prescription and over-the-counter, are locked and secured, and always dispose of unused or expired medications properly at designated take-back locations. And last, ensure and maintain continuity of care for you and your loved ones. Government instability should not threaten your health stability. The best protection against policy turbulence and misinformation and disinformation is having a primary care medical home. If you or a loved one do not have a primary care provider, please make that a top priority. An established relationship with a primary care provider is essential for getting accurate information, ensuring preventive care, and managing medications safely. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.